Welcome to Y107 MU Healthcare's Ask the Expert podcast. March is Colon Cancer Awareness Month, and we've got MU Healthcare's gastroenterologist Matthew Bechtold here to talk about colorectal screenings and more. Doctor, when do you need to be screened for colorectal cancer?
That's a great question. They just recently changed the guidelines to start at 45 years old to start your screening for colorectal cancer. It used to be 50, but they recently changed it to 45 because we were finding more and more folks around the country were getting colorectal cancer at a younger age, so we decided to move the screening up.
So does family history obviously play a factor in that, or some other risk factors? What are some other risk factors, I guess?
That is a great question. We're not quite sure why the younger folks are getting colorectal cancer these days. There's a multitude of risk factors that go into it, such as family history, like you mentioned, but also obesity, diet, sedentary lifestyle, lack of physical activity. All these things contribute, but we don't know quite yet at this time what's leading to the increased risk.
Who's at most risk for colon cancer?
The people at most risk for colon cancer are those who have a family history of colon cancer, which means someone who has a first-degree relative, whether it be mom, dad, brother, sister, son, daughter, who had colorectal cancer at an age less than 60. Those who are smokers, those who are overweight, all seem to be at higher risk for colorectal cancer.
And those two very important words, early detection.
Absolutely. You're right on track there. The earlier we catch the colorectal cancer, the more we can do about it, the better the outcomes are. During the pandemic, we had a lot of folks that were delaying their screening care for fear of the virus. But what that shows us is that a lot of people had some worse outcomes just because we couldn't catch it as early and they were catching it late, and we had less options and poor long-term outcomes. Very important to get screened when you can. Don't neglect your screening.
Be sure to stay on top of colon and other common cancer screening recommendations. Download the guide, muhealth.org/cancer screening. Now, there's more ads on TV all the time about these at-home or mail-in colon cancer tests as an alternative to colonoscopy. Now, can you give us a bit more info on these tests?
Absolutely. Great question. There are a lot of different types of screening tests for colorectal cancer. One of them is colonoscopy, but there's a lot of other non-invasive tests, such as these stool tests, which are either checking for blood in your stool or cancer-type DNA in your stool. And these tests can be used for screening for colorectal cancer. If any of these are positive, then you go to a colonoscopy to figure out why they are positive.
I mean, they sound really easy. Really, you don't have to leave your home, technically.
Absolutely. You have to collect part of your stool and either take it to the lab if you're doing one type of test, or if you're doing another test called Cologuard, they have a system where it's set up to where you mail it in so they can run their analysis on your stool. And if it comes back positive, then that leads you down the road of a colonoscopy.
It's time for your annual screening, or time for that colonoscopy. What's the best way to go about getting that test done and scheduled?
Well, that's a great question. I think the best way is to talk to your primary care provider, and they can go over options with you to kind of set up what works best for you. And it's very important that we cover this. Primary care providers have a lot to cover with all the health issues that most folks have in mid-Missouri. So it's very important that you talk to your provider about this sort of thing, about screening for colorectal cancer, and then setting up the best test for you. The earlier the better. When you qualify for screening, you should get it done. Don't delay it, because that can lead to poor outcomes down the road.
March is Colorectal Cancer Awareness Month. Another great guest, Dr. Matthew Bechtold from MU Healthcare. He is a gastroenterologist with some important details on screenings, colorectal screenings, colonoscopies, and more. As you talked about earlier, Doctor, a lot of people have been waiting or continue to put off some tests due to pandemic and COVID reasons. Not a good idea, right?
That is true. It's not a good idea to delay your screening for whatever type of cancer you're screening for, including colorectal cancer. I think we've seen a lot in the past year or two that people have delayed their screening, and they come in with a lot worse stage of cancer, a lot worse outcome for their cancer than they would have had if they had screening that had not been delayed. So I think very important, if you're at that age, please get your screening done, because it's vital for your long-term outcomes.
And of course, your PC, your primary care, look at me spitting out lingo, your primary care physician, probably the best place to start with questions, right?
Absolutely, absolutely. They are a wealth of knowledge, and please feel free to bring it up to them, and they'll be more than willing to help you go over like all your testing options and get you on the right track to the one that works for you.
Well, Dr. again, Matthew Bechtold, thank you so much for your time. Stay on top of colon and other common cancer screening recommendations. Download the guide, muhealth.org/cancer screening.